Why does it hurt when I have sex? I'm an OBGYN and today I'm answering that question. Hey everybody, welcome back to my channel, Dr. Jennifer Lincoln, board certified OBGYN, and today I am tackling a question that can be really tough and really embarrassing for some people, but I want you to know, no shame here, we are talking about it all, and not only why does sex hurt, but what can cause it and what you can do about it. And if you haven't already subscribed, go ahead and subscribe and turn on that bell so that you get notified every time I put up new content. Let's just jump into it. You might feel really alone if sex hurts for you, but I want you to know that you are definitely not the only person. In fact, 43% of American women have reported some issue with sex at some point. And 12% of them have experienced it so much that it's caused so much distress that it's interfered with their relationships or with their personal life. So my friend, if this is you, you are not alone, but it doesn't mean that you have to put up with it. So what I want to talk about today is what can cause pain with sex, what we can do to figure it out, and how to get you feeling better. So I'm going to go through a laundry list of things that can cause pain with sex. I want to keep in mind that I will be discussing things like sexual abuse and trauma, and so if that is triggering for you, I will give a trigger warning before that, and you may want to skip that section, or maybe you do want to watch it so that you can realize that it's not your fault and that help is out there. First thing that can cause pain with sex, lack of arousal. This might be because you are just not in the mood for sex, and that is okay. Or it could be that you do want to have sex, but you haven't had enough foreplay to allow your vagina to get lubricated, which can lead to vaginal dryness, and that can make sex uncomfortable or painful. The second thing that can cause pain with sex is vaginal dryness. So it could be from what I just mentioned, that you haven't had enough foreplay or time for arousal in order to have increased lubrication that can make sex feel okay, or vaginal dryness from other reasons, such as going through menopause or having low estrogen levels. We can see this after giving birth or if you're breastfeeding, or something called premature menopause, where you go through menopause earlier than would be the expected age. Sometimes certain medications can lead to vaginal dryness as well. The third thing that can cause pain with sex is something called genito-pelvic pain and penetration disorder. These are newer terms for what we used to call vaginismus or dyspareunia, and all of that is a mouthful. So what this diagnosis is when you have persistent or recurrent presence of one or more of the following symptoms that you can see here, such as difficulty having vaginal intercourse, having pain in the vulva or vagina or in the pelvis during intercourse or when trying penetration, having a lot of fear or anxiety related to this, or having tensing or tightening of those pelvic floor muscles while trying to have vaginal penetration. And these symptoms have to either cause significant distress or have persisted for 6 months or more in order to have the official diagnosis. Often people who are suffering from this will say that their symptoms are like the penis is hitting a wall, and they might not only have pain with sex, but also have difficulty with inserting tampons, inserting vibrators, that kind of thing. The fourth thing that can cause pain during sex are issues with the vulva. Remember, the vulva is the outside part, the vagina is the inside part. And so issues with the vulva can be skin disorders like lichen sclerosus or lichen planus, or nerve disorders like vestibulitis or vestibulodynia. And this is typically described as a feeling like a burning pain or a raw sensation when the outside of the vulva is touched, making it so painful that penetration is not even possible. This fifth category of things that can cause pain with sex, I like to think of things that are where they're not supposed to be. So endometriosis, fibroids, and scar tissue from things like previous surgeries. And so endometriosis is when skins that are similar to the lining of the uterus are found elsewhere outside the uterus, such as on the ovaries, on the bladder, on the bowel. And this can cause pain because it can lead to inflammation of that tissue. It can also lead to endometriosis cysts and scar tissue, just like I mentioned scar tissue from surgeries. And fibroids are little benign, non-cancerous little balls of tissue that are in the uterus, and sometimes they can get really big and they can push on things, or they can alter the shape of the uterus such that having penetrative sex can become really uncomfortable. The sixth thing, infections. So things like herpes, when you have a herpes outbreak, that can really cause a lot of intense pelvic pain, and that could be why you're having pain with sex. Or something like gonorrhea or chlamydia that has gone on to cause pelvic inflammatory disease, which can lead to scar tissue in the pelvis, and that can lead to scarring in the pelvis that can cause pain or discomfort during sex. The seventh thing, not all things that hurt in the pelvis are related to your uterus or your ovaries, so don't forget about the bowel. So issues with your bowels like constipation can cause pain with sex. You might think that's really strange that just being constipated can cause pain, but it can. Other things that affect your bowel, like Crohn's disease or irritable bowel syndrome, all of these things can also make sex uncomfortable. And the last thing that I'm going to mention does have to do with trauma, so I do want to give that warning ahead of time. So a history of trauma, sexual trauma, but also physical trauma. Any kind of trauma or abuse history can make sex painful or uncomfortable, so that even when you do want to have sex, it may hurt when you are having sex. So what do we do when you come in and say, Dr. Jen, I cannot have sex, it hurts too much? The first thing that we need to do is get plenty of information to figure out what's going on in your medical history and your health history, and to see if this is new, if this is linked to any changes in medications or with other medical problems, to really get a full picture of what's going on for you. And then we will do a targeted physical exam. And it's okay if the first time we meet, you don't want to do an exam, you just want to chat about it. You can always come back or request a separate visit. But in that exam, we are looking for signs of all the things that I mentioned before. So we will likely need to do a pelvic exam if that's okay with you, so that we can rule out any infections, so that we can assess for any pelvic floor muscle dysfunction. So we can assess the bladder, the bowel, and basically do a full comprehensive exam, and we're not just getting focused in your uterus, but we're taking into account all those things. And then what about treatment? It depends on what we find. A lot of times, pain with sex, part of that treatment is some kind of therapy, whether it's pelvic floor physical therapy to help teach those muscles to relax. You might think, well, of course I can make my muscles relax, right? I can relax my arm. It's not that easy. The muscles in our pelvis are under a different kind of control. And so working with a pelvic floor physical therapist, either continuously for a few visits or for one initial visit and then you do some exercises at home, either way, whatever's comfortable for you and seems right for you, can really help. And a lot of times this is combined with things like biofeedback, potentially using dilators to help get your pelvis used to the sensation of penetration, starting with something very tiny, like the size of my pinky, and slowly moving up according to your comfort level. Many times we need other forms of therapy, whether it's cognitive behavioral therapy, personal therapy, couples therapy, sex therapy. Having a hard time in the bedroom can be really hard, not only on you, but also on your partner and your relationship. So addressing all of that can be really important, especially if you have a history of trauma or abuse. Directed sex therapy to help teach how to masturbate and what to find pleasure in can also be part of the treatment. And if it's something like endometriosis or fibroids or scar tissue, it might involve surgery. A big part of this is education, knowing what's normal, what we can fix, how arousal and foreplay are important both for you and your partner, discussing good vulvar skincare, avoiding products that are irritating, potentially looking into things like using lubricants or vaginal moisturizers or vaginal estrogen. The bottom line, sex should not hurt. And if it does, we can help, and there's lots of things we can do to fix it. The number one thing for you to know is that if you're feeling pain, we want to know about it and we can help you. All right, friends, that was a lot of information, but it's really important stuff. And I've got tons of good references and resources in my show notes, so go ahead and check them out. And if you've got comments or questions or something else you want me to cover, go ahead and drop a comment in my comment section and follow me on TikTok and Instagram for more. And one last thing, I go into this topic in great detail and a lot of other nuances about pain with sex, what's normal, what's not down there in my book, Let's Talk About Down There, with the link in my show notes to buy if you're interested. All right, my friends, stay safe out there, and until next time, bye-bye.